Good morning, everyone. Okay. It's such a pleasure to have you all here today at the Mississauga-Halton Central West Regional Cancer Program Annual Primary Care Oncology Day. My name is Golruk Ladha, and I am the Interim Regional Director for the Mississauga-Halton Central West Regional Cancer Program. I am so proud to be here today alongside Dr. Scott Barry, our Regional Vice President, to host today's event. Before we jump in, I'd like to first welcome Samantha Moraz to deliver the land acknowledgement.
The land on which the Mississauga-Halton Central West Regional Cancer Program operates has been the site of human activity since time immemorial. It is the treaty lands and the territory of the Mississaugas of the Credit First Nation, and it is also the traditional territory of the Huron-Wendat, the Wyandot Nations, and the Haudenosaunee Confederacy. The land and the lakes in this region continue to be the home to many First Nations, Inuit, and Métis communities from across Turtle Island, which is currently known as North America. They continue to mobilize, live, and care for these lands and its inhabitants. People across Turtle Island have been confronted by the legacies of white supremacy. This includes the legacy of genocide, which Indigenous folks have known all along, and whose demands for action were ignored. It is also on this land that we are confronted by the legacies and the current realities of anti-Black racism and slavery, the legacies of anti-Asian racism and indentured labor, the legacies of anti-Semitism and Islamophobia, the legacies of erasing sexual and gender diversity, the legacies of promoting ableism, sizeism, and ageism, and the legacies of religious violence. These histories are ongoing, and they're not separate from healthcare, but they shape who feels safe seeking care and whose pain is believed, and how clinical systems, including cancer care, are experienced across this region. I come to this work as a quality and performance consultant with the Mississauga-Halton Central West Regional Cancer Program, and my understanding of accountability on this land is shaped by the path that brought me here. I practice as a medical radiation technologist alongside my work in quality, education, and delivering care directly to patients in clinical settings, often meeting people at moments of fear, vulnerability, and uncertainty. That experience grounded me in a simple belief that every patient who comes to our cancer system deserves the same quality of care, dignity, and safety, regardless of where they live or where they enter the system. That belief is what led me into regional system work. And across the Mississauga-Halton Central West, I've seen how variation in access, coordination, and follow-up can quietly shape the patient experience and outcomes. I've also come to understand that these gaps are not in isolation. They reflect broader histories of inequity, racism, and colonial harm, particularly for Indigenous peoples whose interactions with the healthcare systems have too often been marked by mistrust and trauma. As someone whose life and career has been shaped on this land, I'm deeply aware of the opportunities I've had to learn, work, and thrive here. I understand that privilege as a responsibility, and as a treaty person, accountability means using the roles I hold to help close gaps in care rather than widen them. For me, allyship in this context is not a label to claim, but a practice to uphold. It requires cultural humility, active anti-racism, and collaborative advocacy, working with communities, not for them. It also means being willing to ask difficult questions, to slow systems when equity demands it, and to challenge practices even when doing so is uncomfortable. In that spirit of learning, during the inaugural Mississauga-Halton Central West Regional Cancer Program Indigenous Health Symposium, Healing Pathways and Bridging Western Clinical Practices and Indigenous Ways of Knowing, I was invited to be present for a smudging ceremony. I'm grateful for that invitation and for the reminder to slow down, to listen, and to be present. qualities our healthcare systems do not always make space for. It also reinforced that cultural humility requires a willingness to sit with discomfort, to acknowledge what we do not know, and to remain open to learning, deepening my understanding of the importance of place, relationships, and the ways of knowing that they extend beyond the Western clinical framework. My commitment is to carry this learning forward in practical ways by questioning whose voices are missing, embedding equity and cultural safety into quality and performance work, and ensuring that our regional strategies translate into actions that are felt in real clinical settings. I offer this acknowledgement as a commitment to truth, reconciliation, and justice, not just grounded in words, but in ongoing action, partnership, accountability to the original caretakers of this land. Thank you.
Thank you so much, Sam, for that meaningful reflection. We are going to start off the day with a quick review of a few housekeeping items to help the day run smoothly. So restrooms are found near the main entrance just to the left. Breaks will be indicated on the slides and will show when it's time to take a seat. We encourage you to use these breaks to visit with our colleagues and our exhibitors. These community organizations play a vital role in supporting cancer care across the region, and we're so grateful to have them here today. Could I just get a quick round of applause for all of the work that they do? There may also be lots of opportunities to explore collaboration on initiatives with our shared priorities. Each speaker is going to conclude their session with approximately 10 minutes for questions and discussion. We encourage you to use this time to engage, ask questions, and share your perspectives. Finally, your feedback is very important to us. It helps us shape how we structure these days going forward. At the end of the day, please take a few moments to complete the evaluation form that's included in your event package, or it's also available online as an online survey. Your input will help us strengthen future events and better support our collective regional priorities. So today's agenda, we're truly privileged to welcome an outstanding panel of speakers today who will share timely, practice-changing insights and the latest updates shaping cancer screening in primary care. These speakers will broaden our understanding to help recognize common primary care challenges and leverage available tools and support, identify signs and risk factors for GI malignancies to implement appropriate management and referral strategies, support patients through the updated HPV program, and demonstrate knowledge and readiness to implement changes to cancer screening coming later this year. In addition, we will also learn about the Regional Cancer Program strategic plan and anticipated impact on cancer care delivery in our region and how the Regional Cancer Program can assist and support your practice. So I just want you to just take a look at the booklet that you have in front of you. You each have a folder. It contains a detailed event program, an evaluation form, and other materials. We have one scheduled break throughout the event at 10:20 a.m., so you can take a moment to connect and network with your peers and other attendees. There will also be some refreshments outside at that time. In the folder, you'll find a postcard. It looks like the one on the screen right here. This is to be used as a raffle ticket. Please have the booths place a sticker on your passport when you engage with them, and please return it to the RCP table at the front outside in the lobby. One of our members of our team will hand you a raffle ticket. This will allow you to have a chance to win a raffle prize at the end of the day. I would now like to introduce our Regional Vice President of the Mississauga-Halton Central West Regional Cancer Program, Dr. Scott Berry, who will provide some opening remarks.
Thanks very much, Gul, and good morning, everybody. Real pleasure and an honor to be here today and welcome you, and thank you all for taking the time. Just wanted to start out by saying thank you. Thank you for the work you do. I know teams across the healthcare systems are working under pressure. I just got a message that at our emergency today we have 85 people who don't have a bed to be admitted into the hospital, but I know that those resource constraints and those demand pressures are felt keenly in your primary care practices. And yet day in and day out, I also know, because I'm in addition to being a regional vice president, I'm a medical oncologist. You remain the most trusted point of care for patients and their families. That commitment doesn't go unnoticed. I see it with my patients every day, and I know that the work you do has a profound impact. You're often where symptoms are first recognized, where conversations about screening and risk begin, and where patients turn for clarity when the system feels overwhelming. And I know that you're also the constant presence for patients as they move through diagnosis, treatment, and life after cancer. I also know and believe very strongly that strong primary care is really the foundation of a strong cancer system. So let me talk a little bit about our cancer system in Ontario, and I'm actually pretty proud of this. Ontario Health Cancer Care Ontario is it's not perfect, but I think it's one of the best cancer systems in the world, and I think we're very lucky to have this in Ontario, and I think it's really a model for delivering other forms of care. It's organized around regional cancer programs, and Mississauga Halton Central West is one of 14 regional cancer programs. And although there's a provincial outlook on cancer and delivery of cancer services, we know that each of these regions across the province have unique local challenges, unique local opportunities, and we know that connecting with local communities through the regional cancer programs is absolutely essential to delivering good cancer services. We live in a very vibrantly diverse region, and we're proud to work here. It's a very large, one of the largest regions in the province with more than 2.3 million people. The region is growing and will continue to grow, and we expect another 63% population growth by 2035. And as I said, we're vibrantly diverse. More than 60% of people in our community identify as belonging to equity-deserving communities, and 48% have immigrated from other countries. One of the key things about our regional cancer program is working with our partners, meeting our partners and the people we serve where they are, and we have a number of partners. We work with 4 hospital systems: Headwaters, William Osler, Halton Healthcare, Trillium Health Partners, but we also work with Ontario Health Teams, and this is one of the ways of connecting with primary care providers in the region. We work with the 4 Ontario Health Teams across the region. We work with a number of community organizations, and these partnerships with community organizations are especially important in meeting people in our region where they are and understanding the unique needs of the people in our region and meeting those needs. And you can see that, and there's more than 1,500 primary care providers here. I'm glad we have a good chunk of you here today, and we have a growing network of community and independent facilities. But this is really, it's a provincial system, it's a regional system, and it's a system built on strong partnerships and trust between those partners. You're going to be hearing a lot about our regional cancer plan today, and our regional cancer plan is really focused on making sure that every patient in our region, no matter where they live, no matter who they are, has equitable, timely access to the best possible cancer services. And we know we can't achieve that without strong partnerships with you and your teams, whether it's early diagnosis, better navigation, more seamless follow-up, or addressing gaps for those facing the greatest challenges. This work depends on working differently, and it depends on us working together. So today is about learning. We have a great day planned for you, and I'm really looking forward to the talks. It's about sharing the challenges we face and looking at how we can improve working together, because the people in the region are really counting on us to deliver the best cancer services. Thanks again for all of the work you do and for taking the time to be here. We generally value our partnership with you, and this is really one of the highlights of our year as hosting this day, but also the partnerships that we form with you throughout the year. We value your partnership. I hope you leave today feeling supported, better informed, and connected to the regional resources and the regional team who are committed to working alongside you as we hope to make sure that, again, no matter who you are or where you live in this region, you get the best possible cancer services. So thank you. With that, I'm going to introduce I'd like to thank our regional primary care leads, Dr. Baldeep Chera, Dr. Praveen Bansal. They're going to be hosting and facilitating today, and I'd like to ask them now to come up with Gulrich Lada and Isra Khalil for the next phase. Thanks, everybody.
Thank you, Dr. Berry, and good morning, everyone. My name is Dr. Baldeep Chera, and together with my colleague, Dr. Parveen Bansal, we are your hosts for today's event. Just to introduce myself a little bit further, I wear many hats, and I'm very grateful to end up at the Regional Cancer Program. I started off as a board member of the Primary Care Network. I'm also the co-chair of cancer prevention for Mississauga Health, and now the primary care lead for Mississauga Halton as well too. A lot of my partners and my team is here. I do hope you go to all the tables and visit all the wealth of information everybody brings for you today, and have a great conference. And I will pass this on to Dr. Bansal.
Good morning, everybody. Thank you for coming, and it takes a lot of work to put on a day like this. And Baldeep and I, we're set up here, and we do what we do over here. But really, the heavy lifting is done by the team at the Regional Cancer Program, and I would really like to take this opportunity. I would like all of you to thank the Regional Cancer Program team for putting it all together. I've had the privilege of having worked in this position for many years now, and I want to thank Scott and Gul for putting together this team that we work together with and going forward. As Scott had mentioned, there is a strategic plan, and it's good to get an idea of what's happening with the lay of the land in our area. And to that end, we have the privilege of having our interim director, Gul Lada and Isra Khalil here to present this. So I would like to introduce Gul and Isra to the podium, please. Thank you.
Thank you very much, Dr. Bansal, and thank you as well, Dr. Chera. Okay, so we're here today. Our presentation is focused on our strategic plan and how it connects to all of you who are here today. The Mississauga Halton Central West Regional Cancer Program entered the strategic planning cycle, I think it was around 2025, 24, 25, with a mission to ensure coordinated, equitable, and high-quality cancer care across the system and across our region. Given our rising demand, population growth, diverse needs, a focused strategy is key to translating the provincial priorities into local action. So this plan that we're going to share with you today, it outlines our approach, our priorities, and our methods to measure success. The Mississauga Halton Central West Strategic Plan, the road to 2028, is centered around 4 interconnected priorities. These are aligned with Ontario Cancer Plan 6, and it also addresses the region's unique needs and capabilities. Our priorities define both our goals, how we'll achieve them, through collaboration, innovation, and a commitment to quality. As Dr. Berry mentioned, as our population continues to grow and diversify, we must continue to address cultural, linguistic, and social barriers and meet people where they are and address the structural barriers to cancer care, access, and outcomes. Our system must continue to evolve to bring care into communities, support providers, and continuously adapt and improve. So the foundations that are shaping our plan address the evolving cancer care landscape. It tackles access barriers, navigation challenges, and cultural and linguistic factors that impact patient experiences. So it's grounded in provincial alignment, data-driven insights, regional engagement, and offers a roadmap for connected, coordinated, equitable, and patient-centered care. Aligned with Ontario Cancer Plan 6, the First Nation, Inuit, Métis, and Urban Indigenous Cancer Strategy, and the Black Health Plan, our strategic plan aims to optimize the system and patient experience while working collaboratively and collectively with those who share our vision. This is the Ontario model of cancer care. It prioritizes coordinated, equitable, and innovative care to empower patients and improve outcomes across the continuum. At the core of this model is Ontario Health and the implementation through 14 regional cancer programs. This model covers the entire spectrum from prevention and screening through recovery, survivorship, and end-of-life care. And as you can see, primary care and psychosocial and palliative care cover the entire journey. You're there from the beginning, you're there at the end. And our patients in our community count really heavily on their primary care supports. Let me just get to the next slide. So, Ontario Cancer Plan's 6 goals. So the Regional Cancer Program aligns very, very closely with OCP 6, and it ensures that local initiatives that we are driving reflect provincial priorities and standards. OCP 6 advances 5 strategic goals. These are advancing equity in the cancer system, improving the patient care, partner and provider experience, achieving seamless and effective integration of all cancer services, improving cancer outcomes and quality of life for Ontarians, and ensuring sustainable cancer system infrastructure and workforce. By aligning our strategic plan with these goals, the MHCW Regional Cancer Program turns provincial strategic direction into concrete local action, ensuring care is both high quality and tailored to our community's unique needs. The Regional Indigenous Cancer Program strategy is a shared journey of reconciliation, respect, and renewal. Guided by Indigenous knowledge and voices, our strategic priorities that are listed here are commitments that shape a cancer care system that listens, learns, and evolves in partnership. Together with communities, families, and knowledge keepers, we are working towards a future where Indigenous people receive care that is equitably, culturally grounded, and connected to tradition, compassion, and community. We have a booth in this exhibitor area which shows our Indigenous resources. We have our Indigenous navigator and Indigenous coordinator there as well to help if you need any resources. I'm now going to pass it over to Isra Khalil.
Thank you, Gul. Good morning, everyone. Isra Khalil here, Regional Manager. To continue on with our, there you go. Regional plan. One of the big priorities for our regional plan is to address system-level barriers. So we know that screening rates vary across the region, and there's lower uptake in areas facing higher socioeconomic challenges. So what we do at the Regional Cancer Program is we use material deprivation levels to categorize these socioeconomic challenges. So for us, material deprivation refers to how much a community struggles to meet the basic needs like food, housing, and transportation. So areas are ranked from 1 being the least disadvantaged to 5 being the most disadvantaged. And so for simplicity, what we've done here is you'll see the blue areas on the map demonstrate the postal codes with no or minimal material deprivation, while the areas in red and orange feature higher levels of material deprivation. And based on this data, what we've done is we've identified 12 neighborhoods in the area, in the region, where targeted efforts are being or are required and will make the greatest impact to increase the low screening rates. And so using the Ontario Cervical Screening Program as an example, you'll see the table in the bottom left corner shows an average screening rates in the fiscal year 2021 by postal area, and these are grouped by material deprivation. And as you can see, that as material deprivation increases, the average screening rate decreases. And so our strategy to 2028 is to kind of reach those equity-deserving populations, offer culturally responsive services, and expand access to support. So these neighborhoods are where we are focusing our efforts to increase cancer screening rates. As we were building this plan, our big focus, or a central pillar of it, was to ensure that we did deep engagement with our regional partners, which would be all of you, as well as patients. So our vision, shaped by lived experiences and strengthened through collaboration, reflects insights gained from engaging patients, families, providers, and community partners to understand what drives equitable access to cancer screening and treatment. So as you'll see here, we spoke with many, many people. We had input from 1,800 plus voices, 225 patients, 75 caregivers, 12 of our community partners, 275 leaders, and 1,210 healthcare providers like yourself. And through all of that engagement and through everything we've heard, we've used those inputs to create our plan to 2028. So the MHCW RCP strategic plan, the road to 2028, it's a holistic vision. So each of our 4 priorities in the strategic plan work cohesively together to build an equitable, patient-centered cancer system that meets the need of the people in the region. So patients, families, caregivers, providers, and partners emphasize the fragmentation that exists within the region and barriers that can't be solved in isolation. So equity, coordination, co-design, and data work together as the foundation of a responsive, resilient, and patient-centered cancer system. Each priority plays a unique role in this shared vision. Co-designed approaches bring lived realities into the heart of planning and delivery. Advancing equitable and timely access decreases disparities in access to timely, high-quality cancer services so that no one is left behind. Coordinate and integrate care to streamline navigation for patients, families, and caregivers. Data-driven decision-making ensures choices are grounded in evidence and aligned with future needs. And by advancing these priorities together, we remain true to the voices of our region, building a cancer care system that is not only comprehensive, but also deeply human. So if we move on to the first priority of our strategic plan, which is co-designed approaches to improve care, we recognize, and I'm sure you all do as well, that diversity is one of this region's greatest strengths and a key factor that we want to use in planning for the care for the community. So our communities include fast-growing urban areas, established suburbs, and rural regions, each with unique needs and challenges, languages, cultures, geography, and social factors, which influence how people access and experience care, making a one-size-fits-all approach ineffective. And this is why we have to be very careful, and we have to co-develop with community, and we have to really meet people where they are. By embedding the community insight into planning the delivery, we build that equitable, responsive cancer system, which is grounded in the partnership. So in the years ahead, we will ensure cancer care across all stages is co-designed with the people it serves, creating inclusive, equitable, and trusted services. We will accomplish this by embedding co-design into all major initiatives with regular patient-led reviews of our programs and communications. We will be launching a regional patient and family advisory council that reflects the full diversity of our population. So just a little plug in here for that. We will be recruiting and kind of planning for how we can bring patients and family members from across the community to sort of represent and help us tackle the different challenges that we face within the cancer care system. We will also be working with patients and families to go develop resources such as care plans to post-treatment support with patient, family, and providers, all at the center of those approaches. And we will be developing communities of practice so that you all can share knowledge across disciplines and that best practices can be shared across hospital systems within the region. And lastly, we will strengthen our regional psychosocial oncology community of practice work. So this is so we can embed emotional, social, and psychological care into the work that we do.
Okay, you still have to hear me speak for a few more minutes. So. Okay, so the second priority of our strategic plan, and if you want to look closely, you can open your folders. There is a placemat in there that we looked at 2 slides ago. This one, you have a copy of that in your plan, and you can in your folder, and you can access the plan on the website as well. Our second priority is ensuring that by 2028, we will ensure that no one is left behind, and this priority is about equitable and timely access to cancer services. So you all know this, we've said it several times, but we have one of the largest and most diverse populations in Ontario. We face significant health disparities that require a strategic response. Almost 60% of individuals in our community are not native to Canada. They immigrated here, they came here from different challenges and different barriers, and so we need to come and address our needs to these individuals as well. We engage directly with residents through community events, focus groups, education sessions, often with the trusted local organizations that you see here, to build awareness, improve health literacy, and co-design solutions that are based on lived experiences. These insights are shaping initiatives across the cancer continuum, from diagnosis and treatment to navigation, system reporting, and survivorship. By 2028, we want everyone in the MHCW region to have equitable, timely, and seamless access to cancer care, regardless of language, background, or location. Care should be and will be culturally responsive and guided by community voices supporting patients and families at every stage. Our future system will reduce disparities, simplify access, and deliver consistent, high-quality care that reflects the needs of our communities. These are our strategic priorities that are aligned with equitable and timely access. We aim to share knowledge and evaluate initiatives to scale equitable cancer services. We want to create culturally appropriate education material that can be utilized across the region to assist patients as they move through the cancer care continuum. We already have all of our toolkits translated in 10 languages. We're moving to an 11th language. We often reach out to trusted advisors like Dr. Chris Martinuk, Dr. Bansal, Dr. Baldeep Chera, to get physicians who speak the languages of the people that we serve so that they can go out there and translate the messages as well. We extend our reach to primary care providers, ensuring all communities, particularly those that experience barrier to care, benefit from timely early detection, navigation support, and cancer care management. And we partner with the community health centers that you have here today to support individuals. There's local trusted representatives from diverse communities called our community ambassadors and prevention health specialists. They bring education and access directly into culturally relevant spaces. We collaborate with our partner hospitals to understand the needs of growing populations, and we want to really focus on building additional capacity. One of our goals this year is to increase additional radiation therapy capacity through expansion at the Carlo Fidani Regional Cancer Center to improve timely access of care close to home. Our third strategic priority is coordinating and integrating care. For those of you who are here from our Ontario health teams, this is a conversation that we have every day. How do we integrate and coordinate the care that we're delivering? Patients, families, and caregivers encounter many points of support along the cancer journey from dedicated professionals, but the cancer system can feel very complex and overwhelming, particularly for individuals who are navigating social, cultural, language, or geographic barriers. We recognize that navigation must be embedded into how care is delivered. Every patient should know where to go, what to expect, and who's going to be supporting them. By strengthening partnerships across hospitals, primary care, Ontario health teams, and community organizations, we aim to reduce duplication, delays, and confusion for our patients. These partnerships will ensure that patients receive care at the right time, the right place, that integrated, connected care is existing across detection, treatment, follow-up, and survivorship. Our vision for 2028 is streamlined and stronger collaboration across hospitals, primary care, and community partners. So every journey is clear, it's coordinated, and it's centered around the patient and their families. These are our strategic priorities that are aligned with integrating care and streamlined navigation. So we understand that we need to align provincial initiatives to improve care coordination and efficiency. We need to strengthen the screening and follow-up across hospitals, primary care, and community partners. We need to collaborate to improve diagnostic imaging quality and regional coordination. We have 31 Ontario breast screening programs in our region. We will have an additional 6 sites by the end of this year. So we need to ensure that this care for individuals who are going for breast cancer screening is coordinated as well. We also want to assess diagnostic demand and optimize regional delivery through initiatives like Beacon. I'm going to hand it over to Isra for our last priority, and then we'll just talk about how you and the work that you do is aligned.
Thank you. So our final and last priority is improving patient outcomes through data-driven decision-making. And so with the MHCW region among the fastest growing in the province, it's essential to understand not only where we are today, but also where we are heading to meet the rising service needs. And collecting, analyzing, and sharing information helps us identify disparities, highlight gaps in care, and determine where investments will make the greatest impact. So in our region, data analysis is being used to identify screening gaps, predict future demand for diagnostic and treatment, and monitor system performance in real time. So this allows us to respond proactively rather than being reactive and support timely intervention and more equitable access. So by translating information into impact, we are building a smarter, more responsive cancer system that adapts to the needs of individuals, families, and the community. Our vision for 2028 is that decisions will be informed by timely, reliable data that helps us highlight where services and attention is required. So from screening through to survivorship, we're going to be committing to using data analytics to support our planning, help target efforts, and improve care across the region. So the strategic objectives that align with this priority are that we commit to using digital tools and AI to integrate data, identify gaps, and guide timely patient-centered care. We hope to increase access to clear, actionable data for all regional partners so you too can use data to inform your practices and make decisions on better patient outcomes and experiences. We hope to leverage some of the communities of practices that we have in place, create new ones to turn data into improvements and share the best practices and do some knowledge translation across the region. We hope to expand standardization of patient-reported outcome measures, symptom screening, and patient surveys so we can enhance care and experience. And lastly, apply geographic and equity data to identify gaps and target support effectively, much like the screening example I talked about earlier, where we use FSA data to identify socioeconomic disparities and sort of action our screening campaigns accordingly. So this sort of brings us to an overview of our strategic plan. I'm going to ask Gul to come up and just talk to this.
Yeah, so I just want to talk about how this work aligns to cancer screening and primary care, but and then after we do that, we'll just ask if there are any questions as well. So where did this go? Okay. Okay. So co-designed approaches. So how do we think that our work aligns with primary care? And please, speak up if you agree, disagree, want to add on. We think the co-developing our resources supports patients and primary care providers in our region to ensure that the tools, pathways, and patient materials are practical, they're aligned with clinical workflows, and they're responsive to frontline needs. So we do translate our materials. If you go onto our website, you'll see many, many resources, FAQs for patients, fact sheets, other information that we hope that allow them to be more informed and therefore support your practices as well. We're developing communities of practice across our region. We have a psychosocial community of practice, an oncology nursing community of practice, and recently this year have started some specialized ones as well, so pathology, diagnostic imaging, radiation, etc. The goal of this is to share knowledge across disciplines and hospital partners, promoting consistent practices that ultimately will support primary care and improve patient care coordination. For equitable and timely access, we consistently and are always trying to engage primary care providers on new services that exist to support cancer management, guidelines and updates to support timely coordinated patient care. Some of you may have said, yes, Gul, we received your email 200 times in the last month. I am trying, and the Regional Cancer Program is trying to continuously engage and provide this information to you in a timely way. We partner with community organizations as well to provide patient education that supports individuals and then therefore supports primary care providers in delivering informed and coordinated care. One of the things I want to mention is we have had many individuals come up to us. We went live with the HPV transition last year. Many individuals still don't know what is HPV. How do they get it? Some people have confused HPV with HIV. And so it's really important for us as Regional Cancer Program stewards and partners to continue to educate people to ensure the best possible care. Coordinating and integrating care. We want to enhance care coordination between primary care providers and hospital teams to streamline processes, reduce duplication, and improve patient outcomes. An example of this, recently, one of our primary care provider family physicians reached out to us and said, you have an Ontario lung screening program in two parts of your region. Where should the referral forms be going? Which hospital should they be going to? And so that is really the part of the coordination that we need to focus on. Optimizing delivery through primary care provider authorization processes that reduce administrative burden and support timely patient care. And lastly, our goal is to improve patient outcomes. Everything that we do is stemmed in improving patient outcomes. We want to use insights from our communities of practice, share evidence-based practices that help you deliver consistent coordinated care. We want to use the geographical data to target communities with higher needs so that you have You have patients that are coming to you that are informed, that are improving their outcomes, and we're also trying to help you prioritize outreach and improve equitable access. So to plan for measuring our progress, strategy is only meaningful if it's accompanied by clear mechanisms. We are defining measurable targets. We're using data-driven evaluation. We report regularly and track our performance, and we engage our partners in evaluation as well. And we're also drafting annual action plans to bridge the gap between strategy and implementation. Strategy can be very much fluff if it's not implemented and evaluated appropriately. And so this overarching plan is supported by annual action plans that translate our goals into clear, time-bound, and actionable steps, provide practical tools for partners, ensure flexibility to adapt as needs change, and leverage our roundtables to coordinate rollout and implementation. So with that, we are ending our presentation today. Thank you so much for listening to us speak. And if you have any questions, now is the time to ask, and then we'll hand it over.
Thank you for that amazing presentation. I wanted to find out if race-based data is being collected across the 4 hospital partners and immigration as well. Because if we have a plan to focus on advancing equity in this region, we need to also know who we're serving and who we're not serving. So data is, I think, lacking in certain regards to that when it relates to race, immigration status, and other things. I know the postal codes are collected, but is that something that we're going to be working on, standardizing across the hospital sectors?
So we at the Regional Cancer Program use data that's provided to us at a provincial level. So that includes census data, which helps us to understand who are we serving in our communities, where people are coming from. We do have many, many surveys that ISRA can kind of speak to as well, that try to ask that kind of information. Maybe some of our hospital partners can speak to what may be happening at the local level. But the one thing I want to say is, in the last 6 months, the Regional Cancer Program has engaged over 100 community members by going out into the field per se, going to community organizations and speaking to those individuals who are coming from equity deserving communities to try to understand if race, cultural background, immigration status, if these things are barriers to care, and what can we do to address these as well. I'll let Isra speak to the proms and prems a little bit more, and then if anybody else has thoughts.
Yeah, that's exactly it, as Gul was mentioning. So through the focus group work, we do try to engage as many community partners and diverse voices as possible as we develop our PFAC, which is one of our priorities for the next 3 years, but if we hope to get something off the ground this year, we will definitely ensure that diverse voices are captured. But your point is well taken about the data. So as Gul mentioned, we do work with administrative data sources, but I'm happy to say that at the Ontario Health level, at that system level, there is conversations happening. There are initiatives in place like the Black Health Plan and things of that sort, where they are trying to ensure that equity is at the center of kind of the work they do at the provincial level, and that's how we sort of translate it at the local level as well. But of course, it's always top of mind, which is why it's one of our priorities to ensure health equity is kind of centralized. And as this evolves and as data sources are broadened, we hope that we can kind of meet that need.
Thank you very
Yeah, go
much
ahead.
for the excellent presentation. The point that resonated with me is the coordination between the hospital and primary care. And I just want to share a little example how that can affect the quality of care. A patient of mine was going for a biopsy for a lung cancer, and she received a phone call that she missed. And she knows the biopsy is planned on that date, and she called me back that they called me and they left a message I don't quite understand. Do you know what preparation I need to do for this biopsy? And I said, okay, well, lung biopsy, I guess you need to be NPO by midnight. But other than that, I don't know what the message was. And I looked in the chart, and there was no communication to the physician's, came to that physician's office. So I only left with this advice that, okay, call back. What was the number they call? Just you call back. I tried to look number myself. And we are kind of at loss. We just both sit in together in uncertainty that what preparation needs to be done. And patient biopsy was done, and I think everything went well. But that part when patient reach out to us because they cannot reach out to hospital and we don't know what to tell them, that can be improved with the better communication. Thank you.
Her presentation about some of the work that she's doing in patient education. I think patient education, you're right, the system needs to be coordinated better, but then we have leaders like Dr. Zegras, like Dr. Bansal and Dr. Chera, Dr. Jobin Verghese, who's here. The goal is to educate as well. So the Regional Cancer Program develops a lot of patient education tools. We put them on our website. We send out videos that are trying to prepare patients for this type of thing. Dr. Zegras' videos, for example, that we've developed over this quality improvement work are focused on what does a patient need to know before they enter colposcopy, and how do we inform them with the best resources. So that's just like one of the examples, but you're absolutely right, and that's one of our goals, to continue to prioritize this work.
So, first of all, thank you so much for arranging this event, because being a family physician in Mississauga, it's a blessing to be here and know more what's happening. But I'd like to bring your attention to the time frame, like just be practical. You are in a family practice setting, and my patient goes for a mammogram, for example, and there is something that is concerning. So the report comes to me, and I understand that they also inform the patient, and they go for further investigations. You already explained to us about the after, like once the diagnosis is made and what could be available for that. But I'm more concerned about the period between the first investigation that is concerning till the point where they are connected to the caregivers, where they are connected to the cancer center. So I used to work in the northern community, and my most contact was with the Sudbury Regional Cancer Center. We had a program that we were in a very remote community, so I sent my patient for a cancer, like any diagnosis. So now they are waiting for biopsy or to confirm the diagnosis. So to be honest with you, that time frame is the worst period for anybody's life, where there is so much uncertainty. There's a concern, but it's not confirmed, right? So we had a program at the Sault Ste. Marie Center where we had a counseling center, and we would send our patients to them, and they would coordinate, they would let them know what's next, what can happen. So I'm wondering if we could develop something like that in our Mississauga Center, or what are your plans in this regard? Like, we are talking about once the diagnosis is made, the patient is connected with the specialist, but what about that small, not small, because sometimes you have to wait. So I'm sorry if it doesn't make sense, but that's my concern. Thank you.
Absolutely, it makes sense. Isra Khalil spoke a lot about our psychosocial oncology and our social work supports, and I think this is a great message to take back. I can't say with any certainty we have plans in this year to implement something like that, but that is great feedback for us as we think about what we should be developing in terms of supports, and we'll definitely take it back. I do appreciate it.
one of our priorities being, oh, I have a loud voice, but sure, I'll use this. The Beacon program. And the Beacon program, just to elaborate on that, and as it relates to your question, we have developed, and some pathways are better developed for things like lung nodules or liver nodules, and there's pathways and diagnostic assessment pathways. For some tumors, we just don't have those pathways developed. Like, as primary care providers, I'm sure there, we suspect this is cancer, but we're not sure. And I think this is, and there are steps along that pathway, including that time waiting for a diagnosis, which are, critical for the patient. So Beacon is about pathways for those types of patients. The team at Central West has already developed a program like this, and I think that's feedback we can give to them about that critical part of the process. And then I think that over the next couple of years, developing a process for folks that are suspected of having cancer, and getting them into the system more quickly, and including that kind of critical element of dealing with their uncertainty and distress while they're waiting for biopsies is exactly the kind of feedback we need. And hopefully the kind of feedback we'll continue to get through engagement with patients and with primary care providers. So that's very important. But we do have, and that's a provincial program that we're going to be developing here in the region, and I think that we can use that input as we develop that. So thank you.
I'm just going to add to that. I think that as primary care providers, we have an opportunity when we get those kinds of reports saying this is abnormal, you have a follow-up coming, get on the phone, talk to them, reassure them, be there for them until the process is done. I think we have a good opportunity. As Gul had mentioned, as primary care providers, we're part of the journey, the whole journey. From prevention, screening, and even after they get diagnosed. Frankly, we get lost into the system, but we have an opportunity. Many times they'll come to us, my husband's having this or whatever, or family. We're there for them. And after the course is done, we have a role as survivorship or palliative. So get on the phone, be supportive to the best of your ability.
Thanks very much, everyone. We'll hand it over to Dr. Chair.
Sorry, is it okay if I can ask one last question? Yeah, you can. Hi. I'm here. Right, thank you for the excellent presentation. Oncology is always a very, very important aspect of healthcare, as we know, when it's a team effort. I just wanted to ask regarding the changes in the screening, like you talked about the HPV. It was, well rolled out, so we were all aware, and we knew what to tell our patients that, okay, this is the change in the screening program. So regarding the lung cancer screening, I don't think so many are aware even that there's a two-step now. And I just want to know how to access that information better. So for example, we're referring our patients for lung cancer just to mentally prepare them, okay, it's a two-step thing. You're just going to be first interviewed, or not interviewed, just assessed that do you actually, they might ask the question, the doctor, why can't you do that assessment, rather than us going separately for an appointment, wasting time, or how do we do that, what's the process? So we are right now in an area which we don't really know what's the two-step process. So how to access that information more easily, that's all. Thank you.
Okay, so we went live with the Ontario Lung Screening Program last May. And so in our region, we have two sites that offer lung screening. One is at William Osler Health System, and the other one is at Trillium Health Partners. We also have two spoke sites, but the spoke sites are not currently live, so they can't actually do the entire lung screening. They don't have the resources to do that, but our goal is to improve access by onboarding the spoke sites as well. So the spoke sites would be Halton Healthcare, so Oakville, Trafalgar, and Georgetown, Milton, and then also Headwaters in Orangeville. So right now, those two services exist at Osler and at Trillium. If you go on our website, and at the end of the day, I'll take you through the tools and resources that exist on our website. We have all of that information. The first kind of major step is like a cancer risk assessment that is done if a person meets the criteria for lung cancer screening. So lung cancer screening is not the same as cervical, colorectal, or the OBSP. The criteria are so specific. You know, individuals have to be a certain age. They have to have some smoking history, no symptoms, no indications. And so all of that is listed on the website as well. When they're referred in either from their primary care provider, or they can self-refer, and then the system will provide them a primary care provider if they don't have one. Then they will do a risk assessment, and once the risk assessment comes back, then they'll determine whether they need to go in for a low-dose CT scan, and then that would be done at Osler or at Trillium Health Partners. If both of those sites feel like they don't have capacity, the goal is for them to work with their partners in Headwaters and in Halton to then send the patient wherever care is closer to home or wherever they can get quicker access to care, and then they would get their low-dose CT scan completed at one of those sites. And then once they're in the system, then they're regularly checked up on an annual, biannual basis through the providers at the hospital. So I can go through all of those questions at the end, and I can also show you our website. We can also speak outside just out of interest of time, and I can show you where you can get all of that information as well. Okay.
Thank you, Golork and Isra, for the presentation on the RCP strategic plan for the next 4 years.